welcome you back to the program, and we're happy to welcome back Dr. Goraile from the Spinal Pain Specialist Medical Corp, and we welcome you, sir. Good to have you back on the show today.
Thanks for having me again.
Aches and pains, you know, they come in a variety of shapes and sizes, and that's what you folks do over there, is help people deal with them. It could be, you know, caused by surgery, a disease process, a variety of things. But a lot of people just complain about, you know, I have a pain in the back, my back hurts. And they may know what caused it, you know, picking up that third grandchild once too many times, or too much golf, or too much tennis, or just doing something incorrectly, bad posture, bad chair, a lot of causes. From a medical perspective, what do you see as causing most back pain that people come to you with?
Well, back pain is typically caused because of disorders in the spine. Now, you can have musculoskeletal issues around the spine, ligaments, the musculatures. You can have issues with the vertebral bodies themselves, with the discs, the intervertebral discs, with the nerves, the spinal nerves that come out of the spine that go down the leg. But patients who have back pain or leg pain, which is oftentimes referred to as sciatica, need to be evaluated because there are other causes such as hip disorders, sacroiliac joint problems, sometimes even cancer or tumors that have gone unnoticed, or metastatic lesions from other sources, and a lot of referred type of pain that may present itself as back pain, but may not necessarily be due to the normal common causes that we typically see.
Okay, so there's a lot of things that can make our back hurt.
There are a lot of things that can make the back hurt, and it's not just the arthritis that people refer to.
Right.
You know, I just have arthritis and my back is hurting.
Yeah.
It needs to be evaluated so that some of the bad things that are less common can be ruled out.
Right. Talk about diagnosis, because with such a variety of things that can happen, obviously there's got to be an ABC of the testing procedures that you have to go through to figure out what's going on.
Absolutely. Again, most feel that getting an MRI or an X-ray is going to really be the gold standard
Right.
of diagnosis, but it is only one tool that we use. The most important part of a complete evaluation for low back pain is a good history and physical examination. The history that a patient gives and a complete physical exam along with a neurologic exam can make a big difference in terms of what can potentially be the cause. Oftentimes, MRIs can be normal, X-rays can be normal, yet the patients continue to have pain. I brought a little spine here to show some of the structures. This is our friend that we use when we go over conditions with patients. And even though the spine itself can be the source of the pain, we have a lot of other structures such as the sacroiliac joints, which attach our sacrum to our pelvic bone. This joint itself can be a very common source of pain that goes unnoticed. And basically, on both sides, we have the sacroiliac joint that can cause pain down the leg, which will sound and feel like sciatica, but it's not coming from pinched nerves in the back. We can have, this is the hip socket. Patients can have hip pain that mimics sciatica. They can have radiating pain down their leg, and until the hip is evaluated, they won't be able to tell that. In the senior population, oftentimes there are small sacral insufficiency fractures, or sometimes fractures because of osteoporosis that go unnoticed, and they can cause back pain. And sometimes you can't see them on just plain X-rays. So the typical things that are the disc herniations that put pressure on the nerve, compression fractures, or degeneration of the discs, these are all common, but some of the other conditions can also be the source of the pain that need to be evaluated.
Like you said, it could even be cancer.
There are certain cancers, prostate in particular, in the male patient, that can metastasize to the spine. So back pain in someone who could potentially be old enough to have prostate cancer has to always be in the differential diagnosis. So X-rays may not show that.
Right.
MRIs can show that. If there's a history of prior cancer, then that should always be on the list as
Right.
one of the things that we need to check for.
All right, so again, with the variety of things that can happen, the variety of things that can cause discomfort, a variety of treatments obviously available that you folks provide.
Absolutely. A variety of treatments are available. The first thing, obviously, is to make the correct diagnosis. So with a good history and physical examination and a good differential diagnosis list, we will, number one, try to find out exactly what it is that's causing the pain. From that point, the treatment is going to be tiered. You start with the most conservative treatments. In most cases, it requires some physical therapy, some anti-inflammatory medications, muscle relaxers, or whatever else is necessary for that particular condition. And as patients go through that treatment program, the ones who respond, which is majority of patients, we're seeing about 80 to 90% of patients respond to very conservative treatments in the first 4 weeks, and back pain usually resolves. Patients who go beyond 4 weeks and do not respond to the conservative treatments, then they go to the next category, which would be the stronger anti-inflammatories, stronger pain medications, maybe some interventional techniques such as epidural treatments, various nerve blocks, and so forth. And if they do not respond, or if there's a surgical lesion that is noted on the MRI or any of the imaging studies, then they will go to the next step, which would be a surgical evaluation. So almost everybody has to go through the initial phase of a complete evaluation, a diagnosis is made, and then there's a tiered approach to the treatment of those patients.
I think a lot of our folks would appreciate the fact that you don't just start off by recommending surgery. You start off with something very less invasive and work up to that only as extreme necessary and in very few cases.
Correct. I mean, surgery is basically reserved for patients who have failed conservative treatments or patients who display neurologic deficits that would progress unless it was treated surgically right away, or they would be left with functional deficits that would not be good. So if there's a patient who has progressive neurologic issues that needs immediate surgical attention, then obviously the conservative treatments would be bypassed in order to preserve function.
Do you require referral from another family doctor, or can people come to see you directly?
Most people can come see us directly unless they have requirements by their insurance company. Most of the HMO plans will require a referral from the primary doctor. We are the biggest provider of care to members of Monarch Healthcare, so if they have HMO plans that are through Monarch Healthcare, we are a provider for Monarch Healthcare, and they can get a referral from their primary care physician to see us for their evaluation.
Well, we hope that none of us have back pain, but if we do, sounds like the right conservative approach that you're providing for our folks here is the way to go, and start them off as gently as possible and only do what's necessary to alleviate that pain. Sounds like a good approach. Thank you for joining us. Good to have you back on the show today.
Thank you for having me.
Dr. Guraley with us today again. Spinal pain, something a lot of people suffer from. Some great solutions over there available at their facility. We'll be coming back with more guests as we continue with today's program.